Hello there, Dr. Andy Rosenfarb here. Today I want to talk to you guys about the new updates on the COVID situation. I've been receiving so many emails, so many calls, so many direct messages from people inquiring about what my latest thoughts are, my opinions on the COVID situation, both the virus and the vaccination, and specifically inside those questions is how's it going to affect people's eyes? As you guys know, as everybody knows, we've been dealing with this situation for about a year now. For our clinic, of course, our patients have had some challenges in terms of getting to the clinic here. Obviously, for a lot of people, their treatment plans have been stopped due to travel restrictions, which were going on most of last year to New Jersey. We knew there was a lot of international restricted travel. So now that things are starting to open up, people are starting to get back on their treatment plans, which is great. Really, really happy about that. People are getting vaccinated. The deaths are decreasing. So the overall situation looks like it's improving. However, there's still a lot of questions that people have and a lot going on. So I wanted to take some time to go over a couple things, give you guys an update on the COVID situation, what's going on in the clinic, some thoughts that I have, maybe to give you guys a little bit more perspective on like how to look at this, because it's real. It's not really going anywhere, although the situation's improving, and there's still some precautions that need to be taken. So let's start talking about first with the COVID situation. Of course, again, we know we've been dealing this for about a year right now. The good news is that travel's starting to open up, especially New Jersey, where we're located. Was a little bit more of a lockdown going on. New York, New Jersey, the tri-state area, Connecticut. There were more cases due to the populations around here. New York obviously is very densely populated, as is New Jersey. So the governors decided last year to really lock down and create some restrictions, which was appropriate at the time for sure. Now that we're getting a better handle on the disease and how it works, we're seeing that using things like social distancing, of course, masking, washing our hands, taking certain supplements to improve our immune system, healthy lifestyles, getting enough sleep, watching alcohol, reducing alcohol, staying hydrated, watching things like caffeine that are diuretics. And why? Why do we want to reduce things like caffeine and alcohol and stimulants? What kind of categorize as stimulants? The reason that is because anything that's a stimulant can tend to dehydrate us, okay? And when we dehydrate, one of the things that happens, those of you guys in the Northeast or maybe in the Southwest right now dealing with all the cold weather, you may be aware that our mucous membranes start to dry out, all right? So our mucous membranes in our nose, your nose gets a little bit dry, our mouth gets a little bit dry, our skin gets a little bit drier. So what happens is that protective barrier called a mucous membrane, it's that mucus, that liquid that creates a barrier between the air, the environment, and the actual tissue inside of our nose and our mouth. And what happens is when our body dehydrates, or we're taking something that's a diuretic like alcohol or stimulants, coffee, energy drinks, things like this, what happens is that drives fluids out of our body. And when our body starts to dehydrate, one of the first things to go are the protective mucous membranes that protect our eyes, that protect our nose, that protect our mouth. So that's why we want to, drink more water and stay hydrated. Mucous membranes are the number one thing that protect us from infection, right? From airborne infection. So regardless of how much masking you're doing, how much social distancing, how much vitamin D you're taking, vitamin C, zinc, whatever you guys are taking, it's critical to maintain healthy mucous membranes. That means staying hydrated with water. That means having electrolyte in our diet, vitamins, minerals, electrolytes. Now, what do electrolytes do? Electrolytes are things like sodium, potassium, and magnesium that are mineral salts that help the body. They act like little sponges to help keep the fluids in the body. So if you have this situation where you feel like you drank a lot of water and then like you urinate really fast or you kind of pee it out right after you drink, that is an indication that you might be a little bit insufficient or deficient in electrolytes. So consider like an electrolyte supplement like magnesium, potassium. The supplement we use is called Vision Mins, but you can go to any health food store and get like a magnesium, potassium, sodium, drop it in a bottle of water and just keep your electrolytes up. Also things like celery, fruits, vegetables, citrus fruits also have a pretty good high level of electrolytes. So that's a way to do it. I would stay away from things like Gatorade and Powerade just for the sugar content. The idea is right, but we can get more natural electrolytes. Things like bananas, kiwi, apricots are of course high in things like potassium, magnesium. And again, that's going to allow these electrolytes hold the fluid in our body. So it's really important to do that. So again, we also want to watch things that are dehydrating. Again, alcohol, coffee, caffeine, even things like green tea. Everybody thinks like green tea, black tea, Earl Grey tea is healthy for us in a certain regard, but it does have a diuretic property. So coffee is a diuretic, caffeine in green tea, soda, anything that has a stimulant or caffeine or a lot of sugar is definitely going to be a little bit dehydrating. So just keep that in mind. The other thing we could do is use our nasal lavage, like rinse our sinuses, use saline washes to keep our sinuses clear. The other thing I like to do is every morning and every evening, I gargle and rinse my mouth out with hydrogen peroxide. Just go to the health food store. It's totally safe. You don't want to swallow it, but definitely rinse your mouth out. You can even take a Q-tip. This is what we do with our kids as well. Take a Q-tip and put it in some hydrogen peroxide, and you can kind of rinse your sinuses out. Take gargle, rinse your mouth out with hydrogen peroxide. Just be careful not to get it on your clothes because it can bleach it out and stuff like that. But also keep your teeth white, so that's good too. The other thing about staying hydrated, which I mentioned pretty quickly, is it can dry our eyes out too. So if you guys are noticing you have more dry eyes, that's an indication you may be dehydrated. The product we use for that as well is Vision Mins, of course, to get the electrolytes and fluids up, but the LipoVision is we use that as a protective barrier. You can actually take a little bit of LipoVision and the oil you can massage around your eyes. That'll create a protective barrier so that we don't have any virus exposure, because the viruses can get in through our eyes, through our nose, and through our mouth, through our orifices. So those are little tips for you. While we're on the subject, I'll talk about a couple of other things that we're using and found to be extremely useful for keeping our immune system strong. If you listen to our other videos on COVID prevention earlier, or last year rather, we talked a lot about using probiotics, CBD, high potency CBD, full spectrum CBD. The product we have is called Canavision. And it doesn't matter. You can use the Canavision if that's working for you. If it doesn't, you have your own, that's fine too. But the most important thing about using CBD is dosing. That means how much do you actually want to take to get a therapeutic result. I'm going to be doing a whole discussion on this because we've had some new information, having used the Canavision now for 2 years with patients. There's some new information that I want to bring with you guys on that. But we have also found that is tremendously useful in keeping immune system strong. So that's one of the things you guys might not be aware of with CBD. So what we're recommending with CBD right now is taking at least a bare minimum of 150 milligrams a day. Now with our Canavision, that's about 2 dropperfuls. So we fill it up to about 1 milliliter is about 86 or so milligrams, 85, 86 milligrams of CBD. So we're having patients do at least 2 of those dropperfuls a day. Currently, most of our patients are doing 2 to 4 dropperfuls a day of CBD to control inflammation and to also help with their immune system. I'm going to talk a little bit more about COVID treatment, and we'll talk about the use of CBD because it also can be useful if you've gotten COVID and to help if you're getting the vaccines to help mitigate some of the inflammatory effects of that, which we're going to talk about in a minute. So also vitamin D, anywhere from 5,000 to 10,000 IU is super useful. We're also talking about vitamin C, liposomal or lipospheric vitamin C is my favorite kind. Zinc, 25 milligrams a day is fine. Selenium's pretty good. With zinc, guys, just make sure that you take zinc after you've had some food in your system. If you've ever taken zinc on an empty stomach, like I have, you're probably going to get sick. It actually can make you pretty nauseous to the point of actually even vomiting. So it's it's not fun. And if you've ever taken a zinc in a rush or anything like that, or a multivitamin on an empty stomach, you may have had that experience. So just make sure you do that. The other thing that I'm doing, and we have our family doing too, which I find is really important, is this. Viruses are attracted to acid environments. That means when our body's pH is lower, indicating a higher acidic pH, a higher pH would indicate that we're more alkaline. We want to keep our bodies alkaline, right? The viruses are attracted to and they have affinity for acid conditions called acidosis. So the more we can alkalize our body with healthier foods, in alkalizing foods, if you guys go on, say, Google, you want to go on a search engine, type alkalizing foods or alkaline foods. You'll see those charts everywhere. As you might think, it's mostly fruits and vegetables, healthier foods, whole foods, junk foods, fast foods, alcohol, soda, sugar. These are all very highly acidic foods. So look, we want to live, you want to have, enjoy your chocolate, or, if you want to have a coffee, that's fine, but just look to balance. All right. So if you're going to have coffee, you're going to have something that's acidic. I like to tell people to practice like an 80-20 rule. So we're like 20% of your diet would be acidic. 80% of your diet, you really want to have more alkaline. So more fruits, more vegetables, more greens. First thing in the morning, I do a green drink. I make a green smoothie out of chlorella, blue-green algae, spirulina. You could use spinach, kale, okra, throw some beets in there. You could throw carrots, an apple, throw some celery for some good sources of sodium, natural sodium. Maybe a banana, throw in there for some potassium. There's a lot of things we could do to really get that. It's really good to help the bowels move, gets the toxins out, and that really helps well. The last thing that we want to talk about for keeping our immune system strong is gut health, right? Really, really important to make sure that we're taking a good probiotic. A probiotic nurtures the intestinal flora, Acidophilus, bifidus, all these healthy bacteria in our gut that help maintain our healthy immune system. The immune system definitely starts in the gut. So if you have indigestion, irritable bowel, any ulcers or anything like that, or indigestion, constipation, loose stool, stuff like that, look to clean up your bowel. That'll help too. And sometimes with bowel irregularities, especially constipation, can be due to liver congestion. So really pay a little bit more attention to your diet, like fried, greasy foods, fast foods, sugar foods. Try to keep that to a minimum because that's definitely going to tax your immune system a little bit. Also sleep, guys, make sure you're getting enough sleep. Lack of sleep, that's when we repair. That's when our immune system regenerates. So rule of thumb is try to get to bed, be sleeping by like 11 p.m. if possible. 6 hours minimum, try 6 to 8. What's the amount of sleep that you really need? Whatever you do to feel rested. So make sure your body's rested. Also manage stress. I know we talked about this ad nauseum, and you guys who follow my stuff. Stress is one of the number one things that are going to rob you of your immune system. The immune system tanks whenever we get stressed out. And with everything that's going on, I'm sure that you, like most people, are probably dealing with a lot of stress. So if that's something that you're dealing with, make sure you're working out, make sure you're meditating, move your body, stay hydrated, get your sleep, have more fun, get out, get a little fresh air, even if it's cold out, maybe go out for a walk and bundle up, get some nice cool air in your lung, get some fresh air. The air gets stale in the house right now, you get a lot more carbon dioxide. So even open a window for a little while. It's not so bad. Try it. Go out, take a walk, or even a hike if you're inclined to. Take a little hike, or go for a walk either around your neighborhood, or find a path where you can go hiking or something like that. So that's a little bit on what we can do. I just want to give you guys a little review on things that we can do to stay healthy. Now let's talk a little bit about the COVID situation. and normal viruses will mutate down. What that means is they'll get weaker and weaker and weaker. So every flu season, you'll get like the primary strain of the flu, and it usually mutates out and it gets weaker and weaker as it goes in most cases. So the strain is not as strong. Now, because we're not sure of where this virus came from, there's a lot of speculation. Some people think it came from animals. Other people think maybe it possibly came from a lab. It was kind of, they're working on gene therapy, so it may have been some type of genetically altered vaccine. We don't know. That's the truth. The truth is we're really not 100% sure of what is. So we need to evaluate all possibilities and look at the possibility that this could be not a typical virus like people have talked about. They said it's more sticky. Obviously, it has a stronger impact, creating inflammation. We know the big problem with this COVID virus, the specific strain of COVID-19, is that once it gets into our body, it goes right to our mucous membranes. And the problem is what's called the cytokine storm. The cytokine storm is what happens when we get sick, when our immune system inflames. That gives us a fever, it gives us the aches, it gives us a sore throat and the muscle aches and the dizziness, and our whole body is just kind of like, or like a nuclear reactor. So that inflammatory, our immune system creates heat. It generates heat to kill the viruses, right? Because viruses die from heat, right? That's why we use hot water. That's why we sterilize. We know that most viruses will not do well in heat, especially corona family type viruses. So our body produces a fever. It generates heat in an attempt to try to kill the virus. Very, very smart. The problem is we're not sure with this strain of COVID-19 if that actually happens. We're pretty sure it does because the body is doing that and the body is intelligent. So we do want to value the body and pay attention to what the body does, because that'll give us indications as to how the body is reacting to this. So the fact that our body is generating a fever, is getting inflamed, is having, again, what's called this cytokine storm. Cytokines are immune inflammatory substances in the body that create this inflammation, which is good. We want that because that's how we're going to kill the virus. However, in people who are maybe elderly or immune compromised, what happens is the body is kind of older, right? It's the vasculature, the blood vessels aren't as flexible. The organs aren't as efficient. The lymphatics don't drain as easy. So what happens is it's almost like a race car that we're redlining it. You're putting a lot of heat pressure on the body, and some people's bodies just can't handle it. Like, it's so much heat and so much inflammation that people, their lungs will start to swell, or their brain, like meningitis, their brains will swell, or they dehydrate really fast. And one of the things we also know that COVID does is it causes blood clotting, right? So the red blood cells that flow freely around the body and transport oxygen throughout the body will start to stick together. That's one of the side effects, or one of the side effects of this COVID virus. So as the red blood vessels, the red blood cells start to stick together and clump and clot, they move through the body instead of individual red blood cells oxygenating the cells. They can't do that because they're all clumped together. We have these clots going around the body. So now we have these two huge factors going on. One is the inflammation from the cytokine storm. The second is the hypoxia, or the low oxygen, because the red blood cells that deliver the oxygen are tied up, they're clogged up together. So then we have dehydration on top of that, and all the other stuff that happened as a result of these infections that we get. So that's really the concern, and that's what a lot of the vaccines now are talking. They're talking about the vaccines. What they do is they're not 100% sure if they actually reduce transmission. We're still waiting for the verdict on that, because the vaccines that just came out, as we all know, they had to be put out in a rush, so they were not FDA approved. There was very little testing on them. And it's a brand new type of vaccine. The mRNA vaccines are not what has been used historically to treat vaccines. So we're just kind of in a holding pattern to see how effective these are. But there is some evidence showing that those who take the vaccine And the hope is that if you do get sick, if you do contract COVID, that it won't be as bad. So the inflammation and the cytokine storm and the blood clotting and all those harsh effects of this virus won't be as severe, and you can kind of muscle through it a little bit, and it won't like kind of render you to a point where you need to put on a ventilator, which I'll talk about in a minute. That's a big shift as well. So that's really important. I want you guys just to understand about what issues for the physiology in your body that the COVID-19 virus is causing. Again, is really this huge amount of inflammation and this huge amount of hypoxia, of low oxygen delivery to the bottom. So basically all the cells, all our bodies are cells, right? They're all like us. They need to respirate and metabolize. That means all of our cells in our body need to breathe. They need oxygen. They need to eat. They need food in the form of glucose. So if the cells aren't bringing oxygen if the cells, red blood cells aren't bringing oxygen to our tissues of our body, they're not going to be oxygenated, especially our brain, our lungs, our heart. They're going to start to shut down. Also, the inflammation can also break down. They can be very damaging to the body, right? Too much heat, we know we can have a lot of side effects as a result of that. So the good news is we're starting to see a lot of this slow down. We're starting to see cases, but we're seeing a lot of cases, and they're doing a lot of testing, but they're less severe. So people aren't getting as sick. Yes, it's horrible. People are still dying, but we're getting a better handle on it, on how to deal with it. One of the big shifts that is really exciting that I found in terms of treatment is that we're starting to see a big shift from using the ventilators to using hyperbaric oxygen, which a lot of you guys know is something that we've been using in clinic now. One of the reasons we got it last year partially was because of COVID. I know we're using it to treat a lot of conditions, eye conditions, sports injuries. We're using it for stroke, for TBI, traumatic brain injury, a lot of different type of cases. But one of the major benefits for post-COVID or even acute COVID is using hyperbaric oxygen. Why? Because when you use hyperbaric oxygen, it creates a temporary surplus of oxygen. So remember, the cells aren't breathing, which is why people get in a lot of trouble with COVID. So their bodies can't breathe. They're tired, they're in distress. They're like they can't get enough oxygen in the body to fill the cells. So if we go into hyperbaric oxygen and we temporarily get the entire body to start breathing on its own, which is pretty much what hyperbaric oxygen does in this temporary environment, that the whole body can go, oh my God, I can breathe. It's like, imagine like you're trying to breathe out of a straw for, you just can't do it. You're not going to get enough oxygen in your system. So it just increases the body's ability to breathe and respirate, and then therefore regenerate and repair and recover. So hyperbaric oxygen is huge. It's so huge that starting in March, we're actually going to be doing a study, which I'll talk to you guys more about. That's not the purpose of this video, but I'm going to talk to you guys more about that. We're going to be doing a clinical study here at our clinic in Westfield on long COVID or post-COVID syndrome. A lot of people are dealing with this. A lot of people are having fatigue, brain fog, shortness of breath, aches, you name it, all these post-COVID syndrome symptoms. So we found that we've already been treating some patients in anywhere between about 8 to 12 hours on average of hyperbaric oxygen treatment. It's amazing. I mean, people are coming out after like 2 or 3 hours with marked improvement. So not only for treating COVID for people who are kind of in acute distress and the hospitals are putting in these big hyperbaric chambers, but when people get home, there's not too much the doctors have. The conventional biomedicine doesn't really have any treatment for post-COVID yet. If ever, we don't know if they will. So using things like hyperbaric oxygen, getting the body hydrated, reducing inflammation is really important. Now, one of the things we're also doing for patients with post-COVID to deal with the inflammatory side of that is to, of course, hydrate and get the electrolytes and get the water levels up, but we're also using high doses of CBD, full spectrum cannabidiol CBD. We're using our Canavision product, of course. We're having people on about 200 to 250 milligrams a day. So we're having patients go on 4 dropper fulls a day, which is roughly 240 to 250 milligrams of full spectrum CBD a day. Why? CBD is one of the most powerful anti-inflammatories out right now. There's no non-pharmaceutical, in my experience right now, that is better for controlling inflammation. So pre-COVID, while you got COVID, post-COVID, and to keep your immune system healthy, guys, using CBD is one of the best things you can do. I used to take like 1 or 2 a day. I'm up to 4 a day just because I don't want to get sick. And I don't plan on. Even if I do, I know exactly how to treat it. So that's on COVID, that's on the treatment. So the good news is that now that the COVID is less urgent, it's being managed, that we're starting to see more of our patients, and more patients are starting to reach out. So, hey, I get COVID. So here's what I wanted to talk about. When we get COVID, COVID is inflammation, as we said, and it also causes hypoxia. Now, we know that most eye conditions like glaucoma, retinitis pigmentosa, Usher syndrome, Stargardt's, eye stroke, cataracts, retinal occlusions, all these degenerative eye conditions, they have 3 things in common: oxidative stress, inflammation, and poor blood flow or hypoxia. So when we have more inflammation, more oxidative stress because of the oxidative stress from the viral load that's in our body, and inflammation, that can negatively affect our vision. So there is a risk. This is not to freak everybody out, but it's just letting you guys know that if you have a pre-existing eye condition or any other inflammatory condition, whether it's arthritis or autoimmune or thyroid or Crohn's or colitis or asthma or allergies, any of those inflammatory conditions that you have, again, specifically, we're talking about eyes in this case as well, but of course it goes for any condition, that you are at more risk. Why? Because your body's already has this low-grade inflammatory process going on. It's smoldering. You get infected with COVID, that's just adding gas to the fire. You already have an existing fire in your body, and then you get COVID, which is going to amp up your immune system. Your immune system is going to go berserk. In some cases it doesn't. People don't feel anything. But it is adding a more inflammatory process to your body. So there is increased risk. So this is why I spent so much time before this talking about prevention, because if you can keep yourself healthy, which in my opinion, there's been so little and so insufficient amount of information on prevention of keeping your body healthy for COVID, which is why I talked a little bit more about this. This talk is going a little bit longer than I originally had planned, but I really just thought that side was important. And here's why: because prevention, right? The most important thing we could do is stay healthy and keep our bodies safe so that we don't get sick, right? Prevention's the best strategy. Now, if we get sick, how do we deal with it? If we get COVID or we get infected with the virus, what do? We want to make sure we stay hydrated. We want to cool our body down. We want to manage the inflammation. We want to manage the clotting, the blood clotting, so that we can keep the oxygen. Remember the eye diseases too. Most of these eye diseases are a result of hypoxia, reduced oxygen and blood flow to the retina, the optic nerve, and the whole the brain, the visual cortex. So first phase is to try to prevent it. Then if we have it, we want to use natural supplements. I don't care, even if we need like Advil or ibuprofen or Tylenol. Early on, they said ibuprofen wasn't so good, and they're kind of flip-flopping on that. I'm still holding to that. I'm telling people like Tylenol, acetaminophen is probably a little bit of a better bet, just because we're still not sure about that. But look, guys, even if you need to use that, if you need to, take an Epsom salt bath to help cool your body down and stuff like that, or just keep your body's thermostat, keep the temperature down. However you have to do that, just do it. We even have like parents with kids putting like peppermint oil on the back and the neck and stuff like that. Just even like jumping in the shower real quick, take like, 10-second cold shower just to cool your body down. Just do whatever you have to do to keep the inflammation down systemically, because again, if you have a low-grade inflammatory situation, which a lot of these eye diseases are, and then you're adding COVID on top of that, you're exposed to the virus, it can set you up for accelerated vision loss, okay? So if you have been exposed to the virus, which most people have by now, whether you've had symptoms or not is different, but it's my opinion that most of us probably have been exposed to it, Whether we've gotten sick or not, that's kind of going to be different from person to person, but I think everybody's probably been exposed to it already. So pay attention to that. If you notice like you're walking upstairs, you're kind of out of breath, or you're exerting, you're seeing shortness of breath, or you fatigue on exertion, that's an indicator that you may have had it. And the testing may or may not be accurate. The testing still isn't so good yet. So point is, if you've had COVID and you are dealing with some inflammation, you're dealing with some post-COVID stuff, it's kind of serious, guys, especially if you're dealing with an eye condition, because it can dramatically, I've had some patients reach out to me already. This is why I'm doing this Zoom session with you guys right now, this video, is because I just want to let you guys know, like, really take seriously the anti-inflammatory and oxidation part of this, getting the oxygen to your body. So don't neglect, getting acupuncture. Don't neglect taking your supplements. Don't not watch your diet. Get your exercise, move your body, stretch, get the oxygen moving to your body, keep the inflammatory process down, take your supplements. If you have access to Hyperbaric, use it. If you're in our area or you're coming in for treatment in the relative near future, call the office, let us know if you're dealing with that. If you're having any post-COVID syndromes, we can help get you in for Hyperbaric as well as part of your treatment plan. We have 2 Hyperbaric beds right now that we're using. They're busy a lot of the time, but if you call ahead, let us know when you schedule your next visit, we could definitely get you in on that. So the other thing I wanted to talk about is the vaccine, right? So a lot of you guys have gotten the vaccine. Some of you guys are probably still having a hard time getting on the list. I know we're a little bit behind, especially here in New Jersey. We're very, very behind in terms of getting the people accessibility to the COVID vaccines. So we want to make sure that that's available. But we've had a lot of patients recently get the vaccines, and the first vaccine's not as tough, but the second dose seems to be a little bit more potent, and people are getting sore arms and they're getting sick and wiped out for a couple days. They're getting fevers, they're getting malaise, they're getting shortness of breath, they're getting tired. So again, what does that tell us? That tells us that it's activating the immune response and we're getting inflammatory processes. Again, that will set you up for risk. So am I saying don't get the vaccines? No, we're saying that if you know you're going to get the vaccine and you have an inflammatory condition like arthritis or any of these other conditions, or one of these eye diseases like glaucoma, macular degeneration, retinitis pigmentosa, Usher's, Stargardt's, you've had retinal detachments, you have flashes, you have floaters, you have any macular issues or retinal issues or optic nerve, optic neuritis, inflammatory issues, keep in mind that you're at accelerated risk. We just, want to call it what it is. We're not trying to sugarcoat it. We're not trying to scare you either. We just want to make you guys aware to the reality that both the COVID-19 virus and the vaccines facilitate inflammatory process that may have a negative impact on your vision. So knowing that, having that information now before you go in to get your vaccine, if you come down with COVID-19, you test positive, even if you're asymptomatic, your body is still fighting this process. So your immune system is activated and inflammatory processes are going on for your body to actually fight this thing off. So please, please, please keep those things in mind. We recommend the supplements. If you've been kind of away from our clinic for a while, due to travel restrictions or COVID or whatever, please, please, please reach out to us. We are here for you. I am doing every week, I'm doing tons of telehealth consultations now with patients I haven't seen in a while, patients who've had COVID, who have COVID currently, who are recovering from COVID, they're COVID long or post-COVID syndrome. We have patients who are asking questions about the vaccine. We're hopping on calls about that. So please feel free to reach out to my staff. If you want to get back into care, you haven't been able to, get an appointment due to travel. Travel restrictions are opening up in New Jersey. We're starting to get very busy again here in clinic. So I just want to give you guys that opportunity if you're thinking of traveling and coming out to either start your initial treatment or you're looking to, kind of return and kind of get back into your routine, do it. Like don't let your eyes go. Don't stop taking your supplements. Don't, if you have any questions, you can either call or email me or my staff. But please do. Like, your eyes are really, really important. That's why I did this. I took, my afternoon evening. It is about 6 o'clock now on Hump Day Wednesday evening. But please, please, please reach out to me. This is very, very important, guys. And again, this is not to scare you, but I need you guys to be informed on what's going on, because if you're informed, then you understand what's going on and you could take preventative measures, current measures. If you're dealing with this, you're somebody you love or family or friend is dealing with this and they have an eye disease or any other inflammatory condition that could be exacerbated by COVID. And if you're looking to either get started with treatment or you're looking to return and kind of reactivate your treatment, we are booking patients for that. And if you're not sure, you have questions, you have concerns, or you're still concerned you can't get here, maybe you're international, or there are some personal situations that you're dealing with, please reach out to me. Please reach out to my staff. We can hop on a Zoom call. We can hop on a phone call. We can look at your supplements. We can talk about what's been going on with you for the past year and a half. So please, please, please feel free to reach out to us. This is coming to you from me with love, with care, with concern. So we want to hear from you guys. If you've had any issues with COVID, if you've had COVID, you've had issues with the vaccine, if you're having COVID long syndromes, post-COVID syndromes, please reach out, ask questions. We understand conventional biomedicine does not have a lot right now for those situations. There is a lot you can do. So again, feel free to reach out to us. We appreciate all you guys have been reaching out to us and asking questions, which actually prompted this session. So take care. If you want to comment down the box, we're going to post this inside our Dr. Rosenfarb's AccuVision group on Facebook, or again, just call or reach out to us. So take care, everybody. We'll see you soon, and the next video I'm going to put out is going to be on some updates on the CBD. And any questions, feel free to reach out to us. Take care. Have a good night, everybody. Bye-bye.